But basically, we are about to present to you all, to humanity, right, an all-exclusive, one-of-a-kind, first in history hospital experience for the changing of healthcare, of the healthcare system as we know it today, right? So I need for you all to please, please, please share this video. All right, we are about to tap into some true exclusive content in regards to repairing oral hygiene naturally, right? And this here is for the self-healer, right? Mastery, oral hygiene mastery for the self-healer. How do you heal yourself when it comes to your oral hygiene? Let's go. So, first things first, a keynote to really, really take note of, if you will, is going to be circadian rhythm foundations for oral regeneration. So what that means is gum tissue regeneration, that is, it aligns with circadian repair windows, whereas nighttime fasting plus early sleep maximizes saliva flow, stem cell activity, and also periodontal repair signaling. You see, daytime feeding aligned with sunlight enhances oral immunity and intracellular detox. Okay, so intracellular is basically in between. So you have intercellular and then also intracellular. So intracellular, as I said, is in between the cells, right? Intercellular is just how it sounds, inside of the cells. So you're talking about a deep level of detoxification, okay? Now, I'll go over a few fasting protocols that is absolute optimal in regards to oral hygiene regeneration and gum tissue regeneration, things of that nature, right? So when it comes to fasting protocols for gum regeneration, water-only fasting is your safest rhythm, okay? Your safest daily rhythm. And now, how this looks is I want you all to implement a 14 to 16 hour water-only fast, right? And this is based on the circadian TRF. If you don't know what that is, I suggest that you look that up. I'll tell you. It's time-restricted fasting. Don't never say I never gave you nothing for free. Okay. Like I said, this here is the safest daily rhythm for the fasting for oral health regeneration. It preserves saliva, hydrates oral tissues, but also activates autophagy for intracellular repair in between the cells, right? Now, you also have your occasional 24-hour reset. And that's suggested that you do that 1 to 2 times monthly or bi-weekly, right? Now, this here provides a deeper autophagy pulse, this 24-hour fast, right? It also activates periodontal stem cells, and it promotes collagen remodeling. It requires post remineralization. Okay, so that's after this fast. You definitely want to make sure that you're implementing great minerals to basically rebalance what you may have lost after this 24-hour fast, right? This detoxification, right? So a lot of things that you're going to want to implement is stuff like this Manny Sapote right here, you know, which is full of copper, full of zinc, calcium, potassium, all sorts of great alkaline trace minerals, right? This is that Manny Sapote. Okay? Now, with a 48-hour and longer fast, this here is where it gets dicey, right? Because a 48 plus hour fast for gum regeneration is not approved for gum repair. Why? Because it risks oral tissue stress, to be short. Dry fasting. There's a huge phenomenon right now over dry fasting. Everybody, you know, it's like it's trendy. You know, everybody want to follow this trend about dry fasting. But let me tell you one thing in regards to dry fasting. It is totally contradicted when it comes to oral health regeneration. Why? Because it halts saliva flow. Okay? It also increases bacterial acidity, and it impedes regeneration and enter an intracellular level. Okay? Now, an herbal infusion fasting protocol, and this here is, of course, the PPHH-approved variant, right? So the base is going to be distilled water only, non-mineralized, pure water, distilled water, right? Now, the core formula for this herbal infusion fasting that best supports oral tissues, gums, that is, regeneration, is going to be the following. You have nettle leaf, right? Now, nettle leaf is full of iron, magnesium, silica, and also potassium. And then you have your yellow dock root, and that improves mineral bioavailability, clears out metabolic waste as well. So it's a detoxifier, right? Then you have horsetail. Horsetail is actually the richest natural source of silica, and it supports collagen rebuilding as well, right? Now you have burdock root also, right? So when it comes to burdock root enhances microcirculation, and it also purifies blood. A lot of you all already know that, right? And then last but not least, you have mullein leaf. Mullein leaf soothes inflammation, and it also supports oral mucosa integrity as well. Now, you want to use this on a cycle, right, where you're giving yourself adequate amounts of space in between sessions of this herbal protocol, this combination, right? You want to keep a 3 weeks on pattern with 1 week off. Okay? Hydration. Combine clean water to support kidneys. Individualization. You want to make sure that you cross-check if on medications or if you are suffering from chronic illnesses. Okay. Now, the preparation protocol and suggestions. You want to use 1 teaspoon each of nettle, horsetail, burdock, and also mullein, but only a ½ teaspoon of yellow dock root. You want to pour over 32 ounces of freshly boiled distilled water, of course. Cover and steep for 6 to 8 hours. That's right. You heard that right. This is a long time steeping session, right? But the reason of this is because you want to make sure and ensure that you are getting absolutely the most out of the medicinal properties of each and every one of these herbs that's being used in its herbal infusion fasting protocol. Okay? So, also, you want to strain and refrigerate and sip slowly during your fasting hours. And the effects of this herbal infusion is going to be that it does provide bioavailable minerals, as I discussed, and silica for collagen repair. It also enhances stem cell microsignaling also. And it gently purifies blood without depleting minerals. And it supports saliva glands for continuous tissue protection. That's why the preservation of saliva is so important. And what this is best for, as far as the herbal infusion fasting, is going to be for those severe cases, right, where you're dealing with bleeding gums, advanced gum loss, but also poor oral regeneration, right? And the duration of this, you're talking roughly 12 to 18 hours, right? Daily fasting, or a 24-hour weekly reset. Now we'll move forward to the juice supported fasting protocol. And of course, this is a PPHH variant. So you want to implement cold pressed PPHH approved juices such as seeded grapes, seeded wild watermelon, and also wild purslane. But don't forget prickly pear as well, full of collagen, full of mucilage. All right, so it provides antioxidants and minerals to the intercellular spaces now. Now we're tapping into those inside of the cells, right? It also supports blood flow to the gums, and it's best for individuals unable to safely sustain water-only fasting. Biological mechanisms supporting gum health. Autophagy. Some pronounce it as autophagy, right? What that is it's basically cellular cleanup of inflamed gum cells, but not just gum, all connective tissues, right? Stem cell activation, especially during 24-hour water-only fasts. Collagen remodeling. Primary healer, or actually collagen remodeling, is mineral supported fasting, and it rebuilds gum scaffolding. Saliva preservation. Now, saliva preservation is the primary healer of oral tissues, that is. And it also protects at all times. You need saliva preservation. Now we'll cover practical implementation guidelines. So, daily 14 to 16 hour water only fasting with mineral balancing herbal infusions. Monthly, 1 24-hour or 2, right? Because like I said, it can be bi-weekly as well, right? 1 or 2 24-hour water only fasts aligned with early sleep and morning hydration. Never ever implement dry fasting when it comes to gum repair, right? So if your target goal is to repair your gums or your oral connective tissues, never ever implement dry fasting. Totally contradicted. Okay? Always remineralize with alkaline herbs and also foods immediately after your fasting windows. Now, the key takeaways is going to be align oral care with circadian rhythms for maximum repair. Use PPHH-approved herbal infusions to support gum regeneration. Short-term safe fasting boosts stem cell activity and collagen remodeling. Hydration and mineral support are essential during all fasting windows. Monitor individual needs if on medications, pregnant or nursing. All right? So pretty much that's all that I have for you all today. There are certainly a much fuller version of this where I go into much more details. There's also a second lecture and a third lecture that I have not covered, right? And what those do go into, just to kind of give you a clue, is the exclusions explained, right? So those traditional to-dos when it comes to rebuilding oral health, right, that we have been taught for decades, such as oil pulling and other useful things as well, right, that we have been taught for decades. Like I said, I go deeper into the science behind why I excluded certain aspects, right, that are those key traditional uses that we are familiar with, right? And then in the third lecture, I go into some safe PPHH approved toothpaste and also mouthwashes as well. So some alternatives that you all can implement that will certainly be most safe for you all. Now, if you all are interested, like you see in the pinned comment, just comment below Ancient Chi PhD, because I do have the recorded session of the full 1 hour session, and you can certainly have access to that. It's only $11.11, so it's fully accessible for pretty much anybody and everybody on any budget on the face of the earth, right? I mean, that's pretty much the cost of a meal these days, right? So with no further more, I definitely appreciate everyone who shared this video, everyone that's going to help spread the word, and everybody that basically joined on today. Thank you all so much for your time. I love you all so much, and I'll see you all next week, or actually in 2 weeks from now, because we will be going over the herbal tea. Basically, I'll be going over like herbal tea combinations and different herbs that's safe to use, what they do, cautions as well, what to stay away from if you're dealing with pregnancy, if you're dealing with this, if you're dealing with that, right? Mineral compositions, or consistencies or whatnot. Constituities is what it's really called. But I feel like I'm talking too much. I've covered a lot. It's getting late, and I want you all to sleep well, because remember, resting between the hours of 10 o'clock p.m. to 2 o'clock a.m. is absolutely and without a doubt the best window of connective tissue repair. So all of this, what we just went over today, means absolutely nothing if you're not sleeping between the hours of 10 and 2 a.m. 10 p.m. to 2 a.m. 10 p.m. to 2 a.m. Peace, love, harmony. I love you. I'll see you all soon. Unconditionally.